Hi, I'm Dr. Khurrum Shaukat Yusafzai. Today's video is about deafness. The deafness is of two basic kinds: sudden sensory neural hearing loss, and the second is acoustic trauma due to loud sounds. Hyperbaric medicine will be explored treatment for these two kinds of deafness along with the traditional medical treatments. Sensory neural hearing loss occurs because the root cause is the internal ear, and the damage is usually permanent if not treated. It can be mild, moderate, or severe, or profound, or total hearing loss, depending on the causative factor. Sensorineural hearing loss occurs as a consequence of damaged or deficient cochlear hair cells. Hair cells may be abnormal at birth or damaged during lifetime of an individual. There are both external causes of damage, including infection and ototoxic drug, as well as intrinsic causes, including genetic mutations. A common cause or exacerbating factor is prolonged exposure to environmental noise or noise-induced hearing loss. Exposure to a single very loud noise such as a gunshot or a bomb blast can cause noise-induced hearing loss, and using headphones for prolonged periods of time can also cause sensory neural hearing loss. Concerts and working in between loud machinery can also cause hearing loss. Sudden sensory neural hearing loss, that is defined when the hearing loss is more than 30 decibel or more. This can happen suddenly, and about 5 to 20 individual per 100,000 annually in the United States are affected. There are many factors that can impact the treatment and the recovery, including age, degree of hearing loss, the frequency range, and the presence of dizziness along with the deafness. So the usual mode of treatment is actually steroids and certain medications, but the results of this classic or traditional treatment is not very good. So FDA recommends that along with the steroids and the medical treatment, hyperbaric oxygen treatment should be taken. That will actually increase the chances of healing tremendously. The sudden sensory neural hearing loss, as you can see, happens in the internal ear, and the internal ear is in the shape of a cochlea, and there can be changes in the internal ear in the nerves that can cause these changes. So what are the factors which can make this happen? That can be vascular, like thromboembolic diseases, labile hypertension, microcirculatory disturbances, viral infections, autoimmune disorders, metabolic disorders like hyperlipidemia, diabetes, toxic agents like exposure to certain ototoxic drugs, carbon monoxide poisoning, diving injuries like barotrauma, decompression sickness of the inner ear, and certain miscellaneous things like rupture of the membrane. There is a round window, a small one, where the small bones like malleus incus and stapes is attached to the inner ear. Sometimes that get ruptured or damaged. Interlabyrinthine membrane rupture is also one of the another thing. So because of these things, the sudden sensorineural deafness would occur, or hearing loss as we say, SSNHL. Apart from the problems I enumerated, there can be problem in the outer ear like wax, otitis externa, and trauma. The middle ear can also have some conductive problem like otitis media and barotrauma and perforation and things that can also cause deafness. So these things should also be considered while doing the diagnosis. The problems of the conventional treatment of this sudden hearing loss is that uh, it involves infusions and vasodilators. So the infusions are there to improve the microcirculation. The effectiveness of these measures, however, remain unproven, and the studies have demonstrated in 1980 that these are not very effective in the treatment of the sudden sensory neural hearing. So here is the list of studies that happened from the year 1979 to year 2000. As you can see, the different results. After the year 2000, from 2001 to 2001, there were a couple of studies done on the same thing. After 2002, right up to 2007, a lot of studies were also done on the deafness of sensory neural kind all over the world, and different and varied results were obtained, as you can see. So this is the case study of a 81-year-old Caucasian male who arrived with sudden deafness of sensorineural type. So he was evaluated and he was treated with 2 weeks course of steroids and other medicines, along with 3 weeks course of hyperbaric oxygen treatment, which cured him, and he was all right. And there is 81% recovery with such treatment. The rationale of hyperbaric oxygen therapy and deafness is that HBO increases the oxygen partial pressure in the inner ear. Experimental evidence for this has been produced by Lamb. The insertion of oxygen sensitive microelectrodes in the inner ears of guinea pigs led to drop of PO2 partial oxygen pressure in the scala tympani. The animals were placed in the hyperbaric chamber, and after it was flooded with oxygen at normal pressure, partial oxygen pressure was noted to be increased by 204%. When the pressure was raised to 1.6 bar, partial pressure increased by 563% as compared with the original value. The increased oxygen supply corrects the hypoxia. Second, hyperbaric oxygen therapy improves hemorrhagiology and contributes to improved microcirculation. HBO not only lowers the hematocrit and the whole blood viscosity, it also improves the erythrocyte elasticity and also causes angiogenesis, new blood vessel formation. Acute acoustic trauma occurs due to very loud sounds like that of gunfire or cannon fire or the fire firing a very heavy weapon, like in the military service, and because of very loud noises like concerts or heavy machinery, which when working can damage the hearing, and we call it acute acoustic trauma. The symptoms of acute acoustic trauma is that noises that used to sound clear are now muffled or indistinct. To hear others well, they must speak louder. Frequently raising the volume on devices, ringing in the ear like tinnitus can happen. Hearing impairment may include one or both ears. Hearing loss impacts your ability to communicate. So these are the signs and symptoms of acoustic trauma. And acoustic trauma, there are certain sequelae. The sound of moderate intensity, as encountered in everyday life, will not cause acoustic trauma, but the loud noises will. And the sequelae that results are the failure of the outside hair cells and the inside hair cells inside the inner ear, rupture of cell membranes and decreased cochlear blood flow, decrease of hearing potential corresponding to decrease of oxygen detection in the inner ear. Because the loud noises can be divided into those which are about 100 decibel in intensity, they can cause damage to the internal ear. For example, the oxygen partial pressure will decrease inside the internal ear. And because of this, the hair cells get damage, and because of this damage can result in permanent hearing damage if it is not treated in due time, because if it's late, then it will not be treated. And as you can see that the oxygen partial pressure has decreased, the potassium ions and the sodium ions have changed, and these changes in the internal ear is the reason that the hearing loss has happened because of sound equal to 100 decibel intensity. Noises that are above 158 decibel, like gunfire or cannon fire, or like those happening in the military with loud explosions in the environment occurring and damaging the internal ear, can cause acoustic trauma. As you can see, the partial pressure of oxygen also decreases here inside the internal ear, and the potassium ions and the sodium ions are also affected. But there is an additional damage occurring because of this kind of very high loud noises, which are around 158 decibel, that that the that inside the cells are also destroyed, like the cells are also destroyed, and this can lead to maybe permanent damage, which if not treated with hyperbaric oxygen can lead to permanent damage, and if treated in time, it can give very good results. The clinical studies of the use of hyperbaric oxygen in the acute acoustic trauma demonstrated that if the hyperbaric oxygen treatment is used along with steroids and some other medical treatment like hydroethyl starch, can cause marked improvement in hearing. If hyperbaric oxygen therapy is not used, the response with the medication was only 74 decibel improvement, while with the hyperbaric oxygen therapy it was more than 121 decibels. The rationale of the treatment is this, that because of the hypoxia, the sodium and potassium pumps are disturbed inside the inner ear, leading to structural damage to the inner ear, which can be prevented if the oxygen is corrected, leading to reverse of the damage. And when the blood supply of the cochlea is improved, it will cause healing and the deafness is removed. So hyperbaric oxygen therapy is very powerful because without it, the treatment was demonstrated to be not as good as without hyperbaric oxygen therapy. So I would say that the rationale of the hyperbaric oxygen therapy, along with the other medical therapy for treatment of acoustic trauma and also for the acoustic other condition, is advisable. In the conclusion, I would like to say that the literature on the use of hyperbaric oxygen therapy in otolaryngology or the ENT for deafness is not that much, but whatever is present there has demonstrated effectively, and there is agreement that certain deafness and acute acoustic trauma are good indicators for hyperbaric oxygen therapy. There is improvement of these conditions, and if the treatment is carried out soon after the onset of symptoms, like within few days or weeks, then improvement can occur. But if it is delayed for years, then maybe the improvement would not happen. So I hope you liked my video, and I hope you subscribe to my channel after liking this video to get such informative videos and easy for you to come back. So I hope to see you soon. Take care. Goodbye.